Hello, I'm Michelle Levander, Director of the USC Center for Health Journalism. Thanks for joining us today, and welcome to our Health Matters webinar covering coronavirus, women in crisis. Today, we're going to be discussing the disproportionate toll of the pandemic on women. C. Nicole Mason, one of our speakers today, has called what we're experiencing a she session. President Biden has called the impact of COVID-19 on women a national emergency. Nearly 3 million women in the US have left the labor force in the past year, and nearly two-thirds of mothers have been in charge of supporting their children's remote learning during the pandemic, an effort that inevitably interferes with work and work opportunities. Here to help us explore the policy agenda and ideas for reporting on these central issues for your audiences and communities, we have three distinguished experts. They'll walk us through trends in homes, small businesses, corporations, and communities. We'll start by hearing from C. Nicole Mason, the President and Chief Executive Officer of the Institute for Women's Policy Research, a nonprofit focused on pay equity, economic policies, and research impacting women. For the past 2 decades, she has spearheaded research on issues related to economic security, poverty, women's issues and entitlement reforms, policy formation, and political participation among women, communities of color and youth, and racial equity. And then we're going to hear from Jessica Calarco, an associate professor of sociology at Indiana University, Bloomington. In her pandemic parenting study, she uses longitudinal surveys, daily diaries, and interviews to understand how families with young children are responding to the COVID-19 pandemic. In the social networks and parenting study, she uses surveys and interviews to identify factors shaping decisions about vaccines, breastfeeding, co-sleeping, and screen time. Her previous research examines how inequalities impact families, students, and schools. And finally, we'll hear from Maria Aspen, senior writer at Fortune, where she covers finance, gender, health, and the intersection of business and government policy. She's also the co-chair of Fortune's Most Powerful Women International Summit. She was previously editor-at-large at Inc., writing features about startups, finance, technology, gender, and international business, while overseeing Inc.'s financial coverage and its annual Female Founders 100 list. We want to thank the Commonwealth Fund, the National Institute for Healthcare Management Foundation, and the California Endowment for supporting this program. We also want to express our appreciation for donations to support this programming from individual participants like you. You could tweet about this webinar at the hashtag covering coronavirus. A word about our format today. We'll be hearing from our panelists first, and then we'll turn it over to you, our audience, for questions. Because we have many people participating in this webinar, we'll ask you to write your questions into the Q&A panel of Zoom. You can write us there if you're experiencing technical problems as well. And we'll be archiving this webinar later today at centerforhealthjournalism.org. We're going to get started with Nicole. And Nicole, you coined the word she session to describe what women are experiencing during the pandemic. And women of color have been hit especially hard. We'll welcome your overview on women's economic and social experience during the pandemic and the trends you anticipate in 2021.
So thank you so much. I'm really excited to be here. And in February, in early last year, in January, we were celebrating a really important milestone. And it was the fact that women were 50% of the workforce. And although we were celebrating, I was very cautious because I knew underneath the numbers that many women were struggling economically because, of the research that we do at IWPR. And then just about 2 months later, when the pandemic hit, we saw all of the economic cleavages that were underneath those gains laid bare for us. Women in February, women fell out of the workforce at 4 times the rate of men. And have more a disproportionate number of the job losses, mainly because they are overrepresented in the hardest hit sectors. So when stay-at-home orders were implemented, those jobs were mostly occupied by women. The service sector, leisure, hospitality, education, and health care services. And if we couple that with, again, some of the economic burdens women were already experiencing, lower wages, pay inequality, fewer benefits in some of these jobs, it was just economically devastating. Not to mention the impact of school closures on women. And so coupling that with the fact that in in August, when schools were set to be open, 865,000 women exited the workforce. And that was due in large part to schools not opening and women really having to make a tough choice about taking care and meeting caretaking responsibilities and staying in the labor force, the workforce. And one of the things I'd like to really stress is that when we think about women who have left the workforce, I want to emphasize that it's not women who come from necessarily who have a two-parent household or economically secure or have a second income to pull from. Many of these women are women who earn less than $40,000 a year, are primary breadwinners in their families, and had to make this choice because of not being able to take off work to meet the caretaking demands of virtual learning for their children. So so when we think about this moment and calling it a she session, it's really recognizing the disproportionate impact of the COVID-fueled pandemic, the COVID-fueled economic downturn on women compared to men. In 2008, it was a recession that impacted mostly men. It mostly impacted the construction sector, production and manufacturing, and now this is not the case. And so when we think about policy solutions, how we move forward, we think about recovery, it's going to really be important to center those most impacted in this moment, women of color, lower wage workers, and our recovery efforts. I don't know how long I have to speak. I have so much more to say, but I can pause there, or I can continue on because I have more to say. But
yeah, no, Nicole, if you wanted to go into your slides or just even expound a little bit more,
we can go into this. I can go into the slides. Do you have them, or should I pull them up?
Yeah, if it's simple for you to do it, otherwise we can pop them up.
Okay, hold on. So I'm popping them up, but I would probably need to share the screen.
Yeah. And folks, just as a reminder, if you have questions, please put them in the question field of Zoom and we'll get to them after we hear from our speakers.
Hold on, I'm just sorry about this. I'm starting the slideshow. So I just want to pick back up on the fact that, again, the COVID-19, so it's actually, again, what you all know because you report on this very often, that it's a health crisis that has fueled this economic downturn, and these two things are intertwined. And so when we talk about women, what I know to be true is that, in order for women to re-enter the workforce, we need to get the pandemic under control, schools open, and then women can re-enter the workforce. But until both those two things happen, we will continue to see women fall out of the workforce. And so here, I just want to point out another startling statistic that nearly 4 in 10 women's jobs have been adversely impacted by the pandemic. And again, it's because of they have been overrepresented in the sectors that were most impacted by stay-at-home orders and are in sectors like the service, leisure, and hospitality industries. And another huge reason when we think about women of color, so in January, we looked at the numbers, 100% of those job losses were by women. But when we disaggregated the numbers and we looked a little bit deeper, what we found is that 100% of those job losses by women were women of color. And again, it points to the fact that, again, women are overrepresented in the service and leisure and hospitality sectors, but women of color make up majority of those workers. And so as the pandemic rages on and stay-at-home orders are still implemented or businesses are not operating at 100%, those women continue to fall out of the workforce, including and because of the fact that schools continue to remain closed. And without the certainty of school, many women are reluctant to begin to search for jobs or re-enter the workforce. So I just want to talk about off-ramping. And so one of the things, again, emphasizing that this idea that women are voluntarily leaving the workforce, what I want to say is that it's a really constrained choice. So women are exiting the workforce in numbers greater than men, but it's not because they're doing it voluntarily or they're stepping out. A lot of it is economic calculation. And another chief reason is because of caretaking responsibilities. And again, 33% of working women between the ages of 23 to 29 say that school and daycare closures are the significant reason for not working, compared with just 11.8% of men. And one of the things that's been uncovered extensively in the media is the unpaid labor of women in this moment. And before even the pandemic, a lot of the conversations that many women were having in private about, struggling to meet their, work and home demands have become public, a larger public conversation, and we've begun to connect the dots. And so now we have more available data on the experience of women and men in this moment. So IWPR, we conducted recently a survey of about 1,500 women from across the country, oversampling for women of color, Black and Latina women. And we really wanted to understand their experiences during the pandemic and what issues they thought the administration and Congress should pay attention to. And one of the things that we found is that many women have, or nearly half of the women have had a really hard time paying their bills, which makes sense. And so when you think about the recovery efforts and the relief that's being debated or even passed at the federal level, it's really critical life-saving supports for working families. And what we also found is that Latino women across the board were struggling and worried in ways that other groups of women were not, or, really feeling the brunt of the pandemic economically. And a lot of it is because, again, where they're most likely to be concentrated in terms of work, but also the fact that some of the relief efforts early on excluded undocumented workers. And that has had a disproportionate impact on, Latino women and families in this moment. The other issue, again, driven by this pandemic, it's a global health crisis, but a majority of Black and Latino women worried about having affordable health insurance for their families. And again, when we look at the sectors that have been most impacted, we know that those jobs are more likely to be lower wage jobs and jobs without benefits and health insurance. And in this moment, during a health pandemic, having health insurance and being able to take care of your family, or even having paid sick leave, is really critically important. And also, Black and Latino women were more likely to say they've needed to take time off from work, but were not able to. Again, I think this is an issue across, for a lot of women, the lack of paid sick leave, but for vulnerable workers or workers who, in order to get paid, you have to leave, there's no remote home and there's little flexibility, these things become critically important. The other big issue that was front and center from the survey is that, again, we were already dealing with the broken care infrastructure, but the pandemic brought that into focus for a lot of families. And so we see that majority of the women said that they either had to stop working or reduce their hours to meet childcare needs, even for a short period of time. And so again, this gives us more context for demands for a national care infrastructure or rebuilding the care economy, which seems to be falling on deaf ears in some ways, but hey. The last thing I want to say, which I think is really, really important in this moment. So a lot of us advocates included, myself included, excuse me, we've been focused a lot on building the care infrastructure, childcare, because that seems like the most pressing need. I'm a, a single mom to 11-year-old twins. And so I've been in virtual learning hell for the last year and a half. And so like that has really been front and center for me and a lot of my, colleagues, and also other moms that I know. But when we asked women what their top priorities were, the top priorities were healthcare, getting the economic recession downturn under control, and unemployment, Black and Latino women, racial justice and inequality were top issues, and taxes and the minimum wage. Childcare was like down below 20%. Many believe that it was important, but when you think about their immediate needs, like having their immediate needs met, these are the issues that rose to the top. And truthfully, I think it's also because women have been dealing with, a broken childcare infrastructure for so long that they figured out how to make it work. But these other things, healthcare, the recession, unemployment, are things that they actually need help with from the federal government at the state level immediately right away. So, it's about their long-term and short-term economic well-being. So I just want to say that, I think there are a lot of really great, interesting topics to explore in this moment that I hope that we, get to talk about in our discussion. But the issue of job creation and returning to work, coping, mental health, and the pandemic, thinking about innovation, public policies and programs, that's really important in this moment. The role of the private sector, a lot of our time, even myself as an advocate, has been spent focusing on the federal solutions and state policy solutions, when in fact, what's going to make a difference in women's lives right now is the private sector. Like, when they're ready to re-enter the workforce, how flexible is that employer? What are their workplace policies and practices? That's what's going to make the difference. So really being able to not only think about federal and state solutions, but also the role the private sector has to play. Again, not over relying on federal solutions, but looking at state level policy levers and change, and a lot of innovation. Many states are labs for really great policy innovations and models. And so looking at those as well. And then this idea that there's not going to be a one-for-one replacement for those jobs that have been lost over in the last year. And some women will have to enter new fields and sectors altogether. So what does that look like? What does the future of work for women look like? That's really important. And then, I also think these are really interesting questions to explore. But I was reading an article in the Wall Street Journal, and they were complaining, in my opinion, that the Biden administration wasn't listening to the experts. And by experts, they meant Larry Summers. Because, and I said to myself that he is listening to the experts. They just don't look like they have always looked when we think about presidential advice, people who advise the president. They're more diverse, they're more people of color, they're more women. And so he is listening to those experts. And so I think that's an interesting sort of angle to be thinking about, like, who gets to say in this moment about what we should be doing. And then also thinking about, like, what's the resistance all about to all these good changes that people say they want? And why aren't we moving on them? What's behind that? I feel like disentangling that is really interesting to me. And then, thinking about what's changed about work in the year, what have we learned in this moment? I think there's been a lot of challenges, but there's a lot of things that we've learned. Like, we've learned more about the possibility of workplace flexibility. Turns out people can work from home and still be productive. And so what does that mean in terms of, how women negotiate and how women enter the sector and how they stay in the stay in the workforce? And then the other big question that I'm always bringing up is, why haven't we ever really worked to accommodate women in the workplace in the first place, even though they're 50% of the workplace? And what does that mean for them economically, their mental health and all these other things? So I'm really excited about this conversation and to hear from Jessica. So I'm going to stop there, and thank you so much.
Thank you so much, Nicole, for this really insightful overview. We're going to turn now to Jessica, and I need to tell everybody that Jessica doesn't have much time because she has a child-related issue, ironically, to contend to in a little bit. But let's just take advantage of the time she has here. And Jessica, you wrote in a recent op-ed that in America, women do the work that a welfare state should do. So take us inside of America's apartments and homes during the pandemic and tell us what your surveys are revealing about the disproportionate burden placed on women at home during the pandemic.
Sure. Thank you so much, Michelle, for having me, and thank you for giving me the chance to share some of the research that my team and I have been doing during the pandemic. So, we know from research that women, and as Nicole talked about so eloquently, that women have been doing a disproportionate share of the labor. I mean, certainly for generations when it comes to unpaid and underpaid labor, but especially in terms of the pandemic and the disproportionate share of parenting labor that women have been called on to do in the wake of this crisis. And so today I'll talk about what our research can tell us, especially qualitative research, can tell us about where those patterns are coming from and what consequences those have for mothers' paid work, for their relationships, and for their well-being. So, to briefly tell you a bit about my research that we've been doing during the pandemic, prior to the pandemic, my team and I were conducting a study of 250 moms in Indiana, and the goal with that project was to understand essentially the gaps between intentions and realities in motherhood. And so we started by surveying mothers during their pregnancies about the kinds of decisions they intended to make as mothers, things about going back to work, whether to breastfeed, whether to vaccinate their kids. And then we followed those same moms for about 2 years after they gave birth, surveying them regularly and interviewing them about the kinds of decisions they were actually making and the kinds of factors that either made it easier or more difficult for them to make the kinds of decisions that they wanted to make as parents. And we were still in the field with that project in March of 2020 when the pandemic hit. And it quickly became apparent how much of an impact the pandemic was having on mothers and their decision making and their employment and their well-being in the wake of the challenges that we've all seen. And so to better understand those patterns, we developed a more targeted set of surveys and interviews about mothers' experiences during the pandemic. In April and May, we surveyed 139 of those original 250 moms about their pandemic experience and then we've also interviewed 75 of them both in April and May and then again in January and February of this year to better understand the kinds of challenges that they're facing, and we've just started interviewing their partners as well. And so certainly the qualitative data, like the data that we've gathered from the interviews with mothers and their partners, are particularly useful for understanding social processes. They can help to answer questions that we often can't answer with just panel survey data. Survey data can tell us how common something is, but it can't always tell us why the world actually works the way that it does. And qualitative data from in-depth interviews, especially when we analyze it systematically, the way that I do as a sociologist and many other social scientists do as well, can actually help to reveal some of those causal mechanisms that we can't get at otherwise. For example, my team and I have papers, qualitative papers in development looking at essentially why employed mothers take on a greater share or have taken on a greater share of pandemic parenting, despite the costs that it has for their careers, even when they have partners who, in theory, would be able to help with that. We also have a paper looking at how disagreements between mothers and fathers about the seriousness of risks of COVID-19 lead mothers to take on more of the work of managing health-related risks related to the pandemic, and a project on how mothers are managing the kinds of guilt that they're experiencing, particularly around increased screen time for their kids during the pandemic as well. At the same time, those small scale data aren't always particularly useful for seeing how widespread a particular pattern might be, or how those patterns vary systematically across different social groups of women or mothers more generally. And so that led us to also conduct some additional surveys with a nationally representative survey sample of US parents, which we fielded in December of 2020. And so today I'll briefly go through some findings from the quantitative data and then talk about some of the insights from the qualitative data before I have to jump off here. So my own research and others has pointed to this idea that mothers are doing a disproportionate share of the pandemic parenting, even when they are also working for pay. And so certainly some dads have stepped up during the pandemic, but mothers on average are still disproportionately doing more. And research also shows that working from home doesn't seem to protect mothers' employment when it comes to the effects of pandemic parenting, and in some cases may even make things worse, with some research showing that mothers who are working from home during the pandemic have worse mental health outcomes than mothers who are working outside of the home. And so Along those lines, research also highlights the consequences that all this pandemic parenting has had for mothers' careers, for their relationships, and their well-being. So these data, for example, show out of that sample of 2,000 parents, just looking at the mothers, of those who were employed before the pandemic, how many of them lost a job, how many of them left a job, how many of them reported that they changed their work schedule. So many mothers that we've interviewed are talking about waking up at 5 a.m. to work or staying up until midnight to get their work done because otherwise they're caring for kids during the day, and also reducing their work hours, similar kinds of patterns here. And then we also see huge impacts of pandemic parenting on mothers' mental health and well-being. 91% of the mothers in our survey reported that they're more tired and have less energy than they did before the pandemic. More than 40% reported symptoms of anxiety, kind of increased during the pandemic. About a third reported increased depression and hopelessness. And about 30% report feeling worse about themselves, feeling feelings of guilt, and feeling like they're letting their families down. And it's also not just individual mothers who are suffering. We also see an impact on mothers' relationships with their partners and also with their children. More than a quarter of the mothers in our 2,000 parent sample report that they're experiencing more frequent verbal or physical fights with their spouses or their partners during the pandemic. And 30% say they're yelling at their kids more often during the pandemic. And about a third say that they're more frustrated with their kids as well. And so these findings raise important questions about why so many mothers are experiencing these kinds of consequences, and why they're taking on so much more of the pandemic parenting, despite the kinds of consequences that work, that unpaid and often underrecognized labor has for themselves, for their careers, and for their well-being. And so essentially, these findings raise some questions. So why, despite these consequences, are mothers doing so much more, especially when they also have a partner, when they also have a child's father at home who might otherwise be able to help with some of that pandemic parenting? And thankfully, our qualitative data can help to get at those kinds of why questions. And so one of the things that we find, to briefly summarize overall, we find that this is deeply related to the gendered structures of paid work that existed long before the pandemic. So first, for example, we find that in many families, mothers were the only parent who was able to work from home, which meant that they were the ones taking on all of the added parenting responsibilities when schools and childcare centers were closed. To give you one example of a mom from our interviews, Janet, for example, has been able to transition to working full time from home as a grant administrator. Meanwhile, her husband is an essential worker who works in healthcare, who is a home healthcare provider. And as a result, Janet was the one who was fully responsible for caring for her toddler and for supporting her two elementary age kids at home with remote learning. She told me in an interview in February of 2021, she said, "My husband's been working outside the home this entire time, and he has to travel quite a bit. So really the bulk of the care is on me." And I asked, "And what's that like for you being home with the kids and working full time while your husband is at work?" And she said, "A lot of resentment. And my husband said he felt a lot of guilt because he couldn't be home. And the few times he stayed home to help with the kids, it was totally chaos. And he had zero patience for it. And it was almost worse because he just got super angry very quickly. He didn't understand why the kids just didn't behave and do their schoolwork." And so I asked, "What was that like for you on the days when he could stay home?" And she said, "It was almost not worth having him there, or at least it's worse because he didn't have a great perspective on helping the kids with virtual learning because he wasn't home every day with me. And it's stressful making sure each kid is scheduled for the day was laid out, which one had group meetings versus one-on-one time and small group meetings. And we had to keep two of them going all day like that." So essentially, because of her partner's paid work arrangements and just despite working full time from home herself, Janet found herself responsible for almost all of the paid kind of pandemic parenting responsibilities. And even on the days when her husband was able to help, Janet found that it was almost, quote, not worth having him there because he would get so angry at their kids for not listening or for resisting their schoolwork. And meanwhile, for Janet, being the primary parent took a huge toll on her well-being. At the beginning of the 2021 or this past school year, Janet had decided to keep her kids home for full-time remote learning because she was worried about the health risks of sending them to school. Over time, though, she really realized that that wasn't feasible in the long term. And as she explained, she said, "My mental health was not doing well as a result of the choices that we've made to keep our kids home. I had some significant depression issues. I would lose my patience. I would just kind of yell at them. It impacted my drinking a lot. I started drinking a little bit more heavily because I'm so stressed out. I started gaining weight again, like 40 pounds in 3 months. It's been really, really hard. I had just started a new job. I was in the job for 7 weeks before we were told to go all remote. And my boss had been wonderful. but I have a lot of guilt around the impact that I'm having on my team. I had to go back to therapy in October as a result of the depression, and it was deep depression. I was in a really dark place, and my therapist told me the first thing she said, she's like, "Get your kids back in school." And so I did, and it's gotten a lot better since my toddler started daycare in January, and that's how we're getting back to a little bit of a healthy place. But it's impacted every aspect of our lives, and now it's impacting every aspect of our lives now too. So like Janet, many mothers have found themselves as the only parent in the household who's able to work from home, which has left them as the only one available to manage the added parenting responsibilities when schools and child care centers are closed. And that's taking a serious toll on mothers' well being. At the same time, we find in our interviews that even when mothers and fathers are both working from home, mothers often earned less than their husbands, which pushed them to sacrifice their own careers and mental health to protect their husbands' higher earning jobs. Here I'll talk about Erica, who's a Latina mother who is working part time. And so before the pandemic, she was working about 10 hours a week, 10, 15 hours a week as a data analyst, kind of doing some regular paid work and some work on the side. And then her husband, who's also Latino, was working full time in marketing while finishing his master's degree. And when the pandemic hit, Erica took full responsibility for childcare and for learning support with their toddler and their 5-year-old at home, who were previously enrolled in full time childcare, but then had switched to fully remote instruction and no childcare for the younger one. And she said, "My husband's job is very demanding, and they talk a lot about flexibility. But at the end of the day, if his boss sets a meeting, he sets a meeting. You can't not go, even during a pandemic, if you want to keep your job. So it's primarily me." Erica also continued that same arrangement. So that was when I talked to her in April, and she's continued that same arrangement during the 2020-21 school year. Talking about her what a typical day is like now, she said, "We get up, we eat breakfast. I have to beg the kids to get dressed, and then we get dressed, and I get ready for work. Meanwhile, my husband holds up in our bedroom because he's using our master bedroom as a home office. So I try to get ready right at 8:30 because if he has meetings, he has them early. And I work 9 to 11 on Tuesday, Wednesday, Thursday. So we go upstairs, and my 5-year-old has a table set up, and she does her classes while I'm working and caring for my 1-year-old. And so I asked, and I said, "How did you and your husband decide that you would be the one who was primarily responsible for watching the kids during the day while you're working?" And she said, "How? Because he's full time. So, whatever pays the most wins. I have my 6 hours a week. It's there for me to keep a toe in the water until my 1-year-old is older. Because I know they say they don't care about gaps on your resume, but they do care about gaps on your resume. But yeah, so that's how we decided. Yeah, I mean, it wasn't really a decision. It was just this by default." So Erica went on to talk about how she sees her job as essentially just something she does part time. And like so many of the other mothers that we talked to who were part time employed or who earned much less than their husbands, taking on full or primary responsibility for pandemic parenting seemed like the only sensible option, given the fact that their husbands were the primary earners and that, especially in the midst of a pandemic with high rates of unemployment, it seemed too risky to do anything that might threaten their husband's job. I won't talk about this case in depth, but a third factor that we found here was that even when mothers and fathers were both home full time, and even in a couple cases where parents had um, nannies or other caregivers like grandparents who were coming to help, mothers often found that kids wanted their attention more than they wanted father's attention or grandma's attention. And so what that meant was that when mothers were working from home with their kids at home, it made it tremendously difficult for them to focus on work and actually be able to get work done, and created tremendous stress within couples as well, particularly in cases where fathers were supposed to be watching kids and kids ended up interrupting moms in their work instead. And so essentially, so what do we take away from all this quickly? I mean, I would say pandemic parenting is taking a serious toll on so many mothers, harming their work and their relationships and their well-being. And yet, despite those consequences, mothers are still doing a disproportionate share of the pandemic parenting, even when they're employed and even when when they and their children's fathers are both working from home. And so we found in our research that those differences reflect the gendered structures of paid work, things like the gender gap in pay and the gender gap in hours. And what that means then is that these inequalities that we're seeing during the pandemic aren't just a function of moms not or of men not stepping up to do their part. They're a function of failed policies, of the lack of affordable childcare, the lack of maternity leave. Those failed policies pushed women even before the pandemic into lower paid jobs and part-time work, and now leave them feeling as though they have no choice but to sacrifice their own careers and well-being for their husband's higher earning jobs. So I will stop there and thank you all for inviting me to join you. Thank you so much to Michelle and to Nicole for your presentation. And Maria, I'm sorry I won't be able to stick around for yours, but I will certainly look forward to being in touch with you all soon. Thanks.
Thank you so much, Jessica, for this wonderful overview. We really appreciate it. We're going to turn down now to you, Maria, and you've written eloquently for Fortune about what you call, quote, the losing battle for gender equity at home and in the workplace, and the disasters driving millions of American women out of the workforce, and the complicated solutions to address them. As you look forward, what trends and story possibilities should reporters be paying attention to in 2021 when it comes to the pandemic?
Well, thank you so much, Michelle, and thank you so much for having me. It's really an honor to share this webinar with Nicole and Jessica, both of whose work has done so much to help and inform my reporting. I'd like to talk a little bit about maybe what drew my attention to this crisis as a story beyond the stark data and numbers that Nicole and Jess have laid out, how we've covered it at Fortune, and as well as tips and advice for continuing to cover it. As I think both Jessica and Nicole have pointed out, it's not a simple story. There's not only one cause, which is part of what makes it such a rich and urgent story for journalists of all backgrounds and all beats to cover. And I have to say, just personally, like, I can't overstate just how breathtaking some of the numbers are. I mean, less than 1 year of this pandemic sent working women back more than 3 decades in terms of labor force participation. That's now fallen to levels last seen in 1988, when personally I was 6. So that's the gains of most of my life and all of my career just kind of erased like that. So, I've been paying attention to the data, the government jobs data, the reports that come out from, analysts and think tanks and economists like Nicole, like Jessica. And my background is as a business and finance editor and reporter. I'm largely a feature writer. I tend to approach most of my business stories through the lens of gender. And I think it was like by September and October when we saw 4 women dropping out of the labor force for every man that I really started pitching my editor hard on, we need to do something big. This is an urgent national business story that Fortune should be covering. And she agreed, and I and my colleagues had been covering it at Fortune in daily stories and in news stories. But her feedback to me and her question was, our national news competitors are covering this, covering it very well. How are we going to move the story forward, and how are we going to advance it? So I and my colleagues continued paying attention to the daily news. Then we saw the really, I think, stunning December jobs report, which came out in early January, when the numbers have since been revised. But at the time, we saw the US had lost 140,000 jobs, but women as a whole had lost more than that, had lost 156,000 jobs. So you had this brutal headline that women accounted for more than 100% of all the jobs lost in this 1 month. And I did a daily news story for our website on that, which got widely picked up. The traffic was good, and MSNBC and other national outlets picked it up over the weekend. And a few days later, I had the green light from my editors to do a big magazine story on this, which turned into more stories, follow-ons. We looked at the public policy aspects and solutions that are needed, some of the private sector solutions that are needed, as Nicole mentioned. I have a Twitter thread pinned with some of the stories that I and my colleagues have done that I can drop into the chat to show how some of my approach to covering this. But I will say for others looking to cover this, one of the nice things about this is that there is regularity to when there's new data. The US Bureau of Labor Statistics puts out its monthly jobs report every first Friday at 8:30 in the morning Eastern. And here is where I admit that I'm a business journalist who sometimes struggles a little bit with data analysis. The BLS website sometimes makes my head spin, but fortunately there are organizations and policy experts and economists like Nicole in the IWPR, the National Women's Law Center, Pew, Center for American Progress. There are a lot of experts out there who have been really helpful to me and my colleagues in parsing this data, in finding the stories, and in telling us what we should be focusing on, helping us figure out the stories. In terms of future angles, I mean, there is a policy angle there. At a federal level, the Biden stimulus proposal obviously does have a lot that that would address this crisis, but there's also state and local policy stories. As Nicole mentioned, the minimum wage, for example, is an increase in the minimum wage is something that would disproportionately help women, and especially the women of color who disproportionately work in service sector industries. It doesn't seem like the minimum wage is going to be part of the Biden stimulus package, but that is something that states and localities have been increasing already, and may continue to do so. There is the healthcare angle. When I started reporting on policy fixes, pretty much every economist and policy expert that I spoke with said, yes, we need more childcare support, we need more paid leave, but we also we need to get vaccines into arms at large scale, just to safely reopen the schools and the daycares and the businesses that employ women. And then the business angles are many. What are big employers doing about this, or small employers? To my editor's question, when we went big in the magazine on a feature on this crisis, one of the ways that we decided to spin it forward was say, yes, this is a national sweeping systemic crisis, and it will require national systemic sweeping policy to change. But also we're fortunate, we cover big business, we talk to big business, and so we've reached out to some of the large employers, the Fortune 500 companies that in some cases employ hundreds of thousands of people, and asked, what are you offering to your employees? Are you concerned about this crisis for women's employment? What sort of childcare support and additional paid leave and flexible hours and part-time benefits are you offering? What are you thinking about how you're going to bring women back to the workforce when this is all over? Last week I did a story on return to work programs, which have existed for a long time, which are designed to help on-ramp women who have stepped back from work usually for several years for childcare or other caregiving obligations. They're immensely popular, and there's just not enough supply from big employers to meet all the demand from women who would like to return to the workforce. And we've also seen a lot of large and small employers come out in the wake of Black Lives Matter and the racial justice protests, especially over the summer. We saw a lot of employers come out and make pledges to do a better job at hiring and promoting for racial and gender diversity. So will they follow through? I think that's something we at Fortune are certainly planning to keep track of, and I would encourage all reporters to do so. And two other business angles I will point out is childcare centers as a business. Those tend to be local businesses. They have been very hard hit by the pandemic. And those are businesses that not only help women go back to work, but also largely employ women, especially women of color. And restaurants are another industry that tend to be local, but that have been extraordinarily hit by the pandemic shutdowns, and where women have lost their jobs en masse, and where issues of wages and pay are especially relevant and important. So I'll leave it there, but I think this is a rich and complex area that requires a lot more coverage.
Thank you so much, Maria. I think before we open this up to everyone's questions, and just a reminder, you can put your questions for our panelists in the Q&A field at the bottom of your screen in the control panel. I just want to ask you both about the Biden relief plan, especially two aspects. One, that it seems very unlikely, as you noted, Maria, that the minimum wage increase will be part of it, and what that means, and what it might suggest for even local or state innovation, and how much this Biden plan can help with some of these really enormous issues. And so I don't know, I'll just turn to both of you to share also around things like childcare and these reentry programs. Maria, you've spoken and written about how fragmented these are. Is it your sense that people are stepping up to the plate on this, or are we really, it's more in the talking than the walking stage of all this?
Nicole, I defer to you on the policy, especially.
So the Biden, the recovery plan. So there's a lot in there that's really good for families, and especially I think this is a bridge moment where people are really looking for a lifeline economically. So the child care subsidies, the expanded unemployment insurance, the food and housing assistance, the direct payments. Families need that assistance right now. That's short term, but the pandemic has exposed that the healthcare system wasn't working for families. The care system wasn't working for families. So that's not incremental change. That's system overhaul. So we need some really big fixes and some real big innovation there. It's disappointing that the $15 minimum wage, which I think is just the floor, not where we need to be and end up, at the end of the day. It's really disappointing because, again, the pandemic and the economic downturn as a result of the pandemic has shown that many families were struggling economically. And the $15 an hour would only bring people's wages up to about $30,000 a year, a little bit more than that. And that's still not enough. And that doesn't include benefits like paid sick and family leave or job security or the other things people need or what we consider to be a high quality job. And the other thing I want to say is that there's bipartisan public support for raising the minimum wage, and Black and Latino women, again, when we polled them, raising the minimum wage was one of their top priorities. So I just wonder how the administration and even Congress is going to reconcile the inaction on this or putting it aside, or if they're going to be able to do that long term. What I'm hoping is that even if it gets taken out of the stimulus package, that we introduce it as a standalone bill, and we do that there. Or I don't know if there's some attempt at getting it into the reconciliation bill, but getting it through during reconciliation. But I don't think that it's something that needs to be dropped off or sort of pushed to the side, because it is a priority that many working Americans say that we need. And at the end of the day, I think it's good for pay equity. It would pull a lot of women, working women, out of poverty. It'd raise wages in general. And so there's a lot of, it makes economic sense.
Thank you. Maria, did you want to weigh in on this?
Well, just picking up on the point about pay equity and the wage gap, I mean, it's worth repeating that women still make less than men. And there's one analysis, and women of color make even less than white women. There's one analysis done by a group of economists over the summer that said that if the gender wage gap is currently 81 cents on the dollar, the pandemic will likely widen that by 5 percentage points to 76 cents on the dollar. And we are going to see when employers get to a point where they are hiring again en masse, it's the women who have been out of work the longest, who have the fewest options, who will not have negotiating power to advocate for higher wages or better working conditions. So I think we're going to see unfortunately some long-term consequences in terms of pay equity. In terms of the private sector programs, the return to work programs and other programs, when we my colleague Emma Hinchcliffe and I, who wrote the magazine piece, and she's been reporting on this as well for Fortune. We didn't poll every single Fortune 500 employer. We called some of the largest brick and mortar retailers. We spoke to some of the tech giants that have long touted some of their flexibility and their benefits for women and working parents. And we got a real mixture of responses. I mean, among retailers, some said they didn't see women being impacted at all. We saw Target, I think, was the one that gave us the most specifics, and they said that they were covering backup childcare for all employees through May. IBM was another company that has long offered sort of part-time and flexibility and to its workers, and has long had a return to work program, and said that it's looking at ways it has increased the eligibility for that program. It used to be that women could only apply for it. Well, it's open to both men and women, but the Chief Human Resources Officer of IBM said that 99% of those who apply to the program are in fact women. And it used to be reserved to those who had left the workforce for at least 2 years. At the beginning of this year, IBM, recognizing that many more women have had to drop out of the workforce, widened the eligibility and said, if you've dropped out for only 1 year, you can apply for this return to work program. Verizon was also somewhat interesting in that they are both a tech company and they have a retail workforce and a more service-oriented component. And they had provided what, in my reporting experience, was an unusual degree of flexibility when there's retail locations closed. They trained all of those effective workers to do remote telesales or customer service work. They allowed many women to go part-time, and they also provided a daycare benefit of $100 a day to all employees who could show a legitimate cause for it. And that was one of the richest benefits that I and many of the economists that I talked to for this story had heard of. And again, these are not systemic fixes, but the Chief Human Resources Officer of Verizon, the Chief Human Resources Officer of IBM, many other executives that I talked to at big companies said, we know this is a big problem. In many cases, the executives are women with children at home who said, I'm not only worrying about this for my employees, I'm living this. I think there is a lot of genuine desire to work on this. It's just, last year, when it comes to the return to work programs, for example, nobody was hiring in general. So it's hard to offer on-ramps back to employment when the company isn't hiring. There is a lot of desire to do more. I think it's just going to be a wait and see to see whether or not there's actual action behind the rhetoric.
Thank you so much, Maria and Nicole. We're going to turn now to the questions of our listeners. One of them is from Anhana Nagrahan Bhutane, who says, teachers have been reluctant to go back physically to teach due to safety concerns, and teachers tend to disproportionately be women, but mothers, on the other hand, cannot go back to work without having their children safely back in school. How do we reconcile this dichotomy to get the economy working for all women?
So I think the first thing, and I think we're well on our way, is getting the pandemic under control. We can't think about opening the economy and getting women back to work or schools open without that being a priority. I'm a mom. I wish my kids were in school, right now for a variety of reasons. But I understand that, unless teachers feel safe, and communities feel safe, it's not going to happen. And so I think for many families, they believe the same thing. So there's often a pitting of women as workers, and then the women who are providing care. And now, it's not a real dichotomy. We really, my priority, or how I think about it, is pandemic, get that under control, get people vaccinated, including teachers, schools can reopen, moms can go back to work, who are not teachers. So I think it's all connected.
And we have a question from Mrs. Valerie Jackson, who says, does your study research look at income levels of women leaving the workforce? Do you identify what percentage of women were in leadership or professional roles, if any? Also, did education levels factor into the job loss percentages?
So that's a really good question. And so for many of the women who have lost jobs since the start of the pandemic, many have been in the service sector, leisure, hospitality, education, and healthcare services. And many of these jobs are low-wage jobs. And those women who, so when you think about women in general, in terms of the unemployment, when you add in educational attainment, the numbers are really even higher. And that's really just because of the intersections between educational attainment and the sectors that were most impacted. But one of the things I think has been really important in this moment is that across occupations, across sector, corporate moms and moms on the front line who are working in the grocery store are all struggling with some of the same issues, granted in different ways, but the issue of care, all women, corporate women are contemplating cutting back their hours or have cut back their hours, and so are women on the front line. So I think that this is one of those unifying moments where women look around or have looked around and said, hey, it's not just me. But again, some women will have bigger barriers to returning to work. I think educational attainment being one of them. And so really, as Biden, I believe there will be a second stimulus recovery package that will focus on job creation. And so making sure those job creation efforts are in sectors that have been hardest hit, but also provide education and training opportunities for women who won't be able to return to their same or similar jobs.
Maria, did you want to comment on this?
No, I think Nicole has identified the major points.
Yeah, so we'll turn to Kate McMahon with PBS NewsHour, and she has a question for Nicole. What's next for childcare policy? Is there any chance we will see a national publicly financed childcare system to fill the gaps between access, affordability, and quality post-pandemic?
So, you're speaking my language right now, and it's what I really, really hope for. I was just on another call, conference talking about the need for universal, affordable childcare infrastructure, and I'm really all about it. I think this is the moment for us to really push and go big and be innovative in terms of thinking about a national childcare infrastructure where no family pays more than 7 to 10% of their income towards care, and that is heavily subsidized by the government. By the way, that the U.S. only spends about 1% of its GDP on childcare policies and family policies. So there's nowhere to go but up in terms of thinking about investments. So I think this is the moment for us to do it. And by the way, we did have some government subsidized childcare programs, and it was killed by Nixon in 1971. And so I think this is the moment where we can really start to think about not just incremental short-term fixes, but really thinking about a system that works for working women and families.
And we had a question, now it's disappeared here. It's from Esmeralda, who is writing about education. And she asks, Esmeralda Romero, what research there is about this sort of dynamic of pitting parents who want their kids at home, have the struggle between the teachers and the parents. And I guess I'll ask Maria too to weigh in on ways that you might approach this in a storytelling standpoint as well.
I can't answer the research question. Nicole, is that something?
The research about pitting women against one another, about
connected to this return to school.
Well, I mean, again, I choose not to see it as a pitting together, get women against, women in this matter. I think we've all been down this road and, past research and books that, stay-at-home mom versus, career mom. It's just not a worthwhile discussion in this moment. I think that focusing on what is unifying women, working moms, in this moment or women in this moment is really key to moving some of the policy solutions and strategies we've been lifting up here. I think the discussion around, parents, I don't want to go down, get too much into the weeds on this, but like, when I was on a call, people were like, oh, well, and you've heard it, like parents are just mad that moms are just mad that their daycares have been taken away or childcare. I'm like, actually, that's not what's going on here. And so to sort of pit it as, or sort of frame it as like moms are upset that their daycare has been taken away because they just want to lounge around at home and I don't know, be carefree. It's just a false dichotomy, and it's just actually not rooted in reality. It's actually kind of sexist. But if we can sort of stay the course and, keep a high level discussion about like what the facts on the ground are, and the facts on the ground are that, we have a care infrastructure that's broken. We have workplaces that have not accommodated women, even though we're 50% of the workforce. And women are responsible in families for figuring out care. Many are responsible for paying for care, and that is translating into low wages for care workers, but not because women don't want to pay more, but because there's things happening like the pay gap and wage inequity. So all these things are connected. And so I like keeping the conversation there, because those are the issues that I think are really salient in this moment.
I would agree, and I would say there's also the aspect of the division of unpaid labor at home. Why is it that women are the ones, more than if they're in heterosexual partnerships, more than their husbands or partners? Why are they taking on the bulk of the unpaid childcare and the unpaid cooking and cleaning and housework? And maybe if that were more equitable, then the schools issue and the schools not being available would create less pressure on particularly on women and on mothers.
Thank you. We have a question from Genesis Ortega. She says, when we talk about why we haven't ever really worked to accommodate women in the workplace, does it boil down to women who are parenting? How does this impact the ability to move up the corporate ladder and ability to receive higher pay?
So my favorite explanation for this, or answer to this question, is this idea of, women are 50% of the workforce, and I just said it a little bit ago, but our workplaces haven't transformed and, bent to that reality. So we're still operating like it's 1950s, there's a primary male breadwinner, women stay home, and then if they do work, it only is like part-time work, or doesn't really contribute to the household income. And that's just not our reality, and it's not the case. But we haven't really thought about, like, if we created workplaces that accommodated half of the workforce, what would those places look like? They'd be more flexible. We'd have more care policies. We'd have more flexibility. And so those things that are not happening. So then you have this idea that women are off-ramping their, to go have a child, or to take care of children, or even care for their parents. But when we focus in, we realize that women don't have a choice because our workplaces aren't flexible or accommodating. So what seems like a choice is really not. So, and it impacts, again, their career advancement. Again, we say it's okay for women to leave, and women should be the caregivers. But again, like someone said, nobody wants to see a gap in your resume. You have to explain that. And so, I think, again, this is a moment where we can really think about, what does a workforce, a workplace look like that accommodates women in the same way we've thought about younger people entering the workforce, or millennials entering the workforce. And really start to, hold both the federal government, but also the private sector businesses accountable to women workers.
And I think I have sort of two answers to that question. One is, I'm covering these topics as a woman without children, so I have not had to do that juggle. But I expect, I expect, like many women, I will continue to take on the bulk of, for example, elder care as my parents continue to age. There are caregiving obligations that women take on beyond childcare that the workforce has not adapted to. And the other aspect of it, again, I write about a lot of senior women at Fortune 500 companies, and there is a lot of research out there that, aside from the child care and caregiving obligations, there's also women are expected to behave a certain way at work and penalized when they are not, which plays into their ability to get promotions and to be rewarded at work, regardless of what sort of practical childcare or caregiving obligations they have. So the workforce does need to adapt in many different levels, at many different levels.
We'll make the final question, because I know we're going over here, from John Nyeko Nayasani, who asks, how do you think a government-backed basic income scheme would help the situation especially with the mental health issues. Some European countries like Finland have done studies and found out that it is a benefit.
Well, I think that the safety net has all but, disappeared over the last 2 decades or so since 1996 in the Welfare Reform Act. And so I'm all for figuring out a social safety net that includes basic income and is not means tested, but based on need. And when people fall out of the economy for job loss or extreme job loss, they can tap into the system. And so I think what is so actually incredible about this moment is that many of these conversations about basic income, direct payments, expanded unemployment insurance, who gets covered, a year ago, people were laughed out, or some of my colleagues at least, were laughed out of rooms for talking about these things as serious, viable solutions or strategies for long-term economic security for people. And now they're on the table, and in some instances we're doing them. So I'm hoping that we see that it can be done. It's just about public will, and so moving people along so we can create a more just, equitable economy that works for everyone.
And Nicole brought this up earlier, but I do think that mental health from a private sector standpoint, as well as a public sector standpoint, is going to continue to be a huge story. And coming out of the pandemic, I mean, I've done a bit of reporting on how employers are and are not adapting to the increased anxiety, depression, and grief that the entire US workforce is facing after just a year of COVID-19 and more than 500,000 deaths. And I don't think the mental health toll of that, or the need to provide more resources for people coping with that, is going to go away anytime soon.
Well, thank you both for your eloquence and your insights. They have been so valuable. This has been a wonderful conversation. And thank you in absentia for Jessica, who had to take off a little early. This has been such a great discussion. The PowerPoints of Jess and Nicole will be available, as well as the recording of this webinar, a little later today. We'd like to urge you to take a moment to fill out a survey about this webinar and your ideas for what you'd most like to see in future ones. And should you want to support our Covering Coronavirus series, you can just send a text to 41444 and type CHJ for further instructions. Thank you so very much. Have a great afternoon, and thank you for joining us.
Thank you.